So who is MA21? The Massachusetts Alliance for 21st Century Disability Policy, known as MA21, has been in existence for more than 18 years, a partnership of self-advocates, family members, other stakeholders, and disability advocacy organizations, including those listed on this slide. You can learn more about MA21 by visiting the website. That's ma21alliance.org. So MA21's action group is currently planning for the 2026 webinars. Listed on this slide are some of the areas of focus that has been discussed to date. We do welcome additional ideas, and if you could include them in the survey or email ma21@arcmass.org. We really do appreciate feedback from everyone who attends the webinars. This is how we can plan for future webinars. And I also want to just encourage everyone, if you have not already signed up to receive MA21 communications, please do so for important updates and also, reminders of the upcoming webinars. And if you are interested in joining the MA21 Action Group, please reach out to us, MA21, again, ma21@arcmass.org. I'm just going to turn this over to Jackie.
Sorry, I have to unmute myself. Yes, just wanted to kind of give you an update. The ARC of Massachusetts is one of the nonprofit groups that are part of MA21. In addition to hosting webinars like this and the MA21 website, we also do our own monthly educational webinar series. We do a lot of work around advocacy. We are currently at hearings at the State House today. We also have the action alerts where we will let you know when things are coming up that we need you to outreach to your state legislator representative. So we just wanted to take this moment to plug some of the other work that the ARC of Massachusetts is doing, where your input can be so valuable. And there are some links here of how you can get involved with some of that work that we're doing. And at this point, I want to just turn it over to Jennifer and Caitlin from the Mass Developmental Disability Council. Thank you.
So much, Jackie. We're a little ahead of schedule. Caitlin has class until 2 p.m. And I believe I was up on the agenda for 1:45, but I will try to fill the time. The reason why the Massachusetts Developmental Disabilities Council was interested in learning more about the self-direction program in Massachusetts is because we have been members of the coalition. I don't know if it was since the inception. I've been with the MDDC now for about 2 years, and I serve as the deputy director there. Obviously, the implementation of the Real Lives Law is very important. We know that research shows that when people self-direct, they are more likely to be employed. They report having higher satisfaction measures in all areas of their life. And what we did know is that in Massachusetts, there's a low percentage of people who opt to use self-direction. So we were really curious to understand more about people's experiences, about why they choose self-direction, areas of the program that work well for them, and maybe areas that they could use some more help. The MA21 Coalition has been working in partnership with the Department of Developmental Services to help ensure that the Real Lives Law is implemented in the spirit of the law. Still working on things like independent facilitators and so forth. The need for flexibility in the program is really important. And we felt that the information that we could glean from the survey could really help to inform how we can work together to improve and strengthen the self-direction program in Massachusetts. Some of you might be familiar with the National Core Indicators. This is a national survey. Massachusetts participated in the most recent collection for the National Core Indicators. And with the type of, and Caitlin knows this better than I do in terms of the official language, but it was a randomized sample. I'm not sure if that's the correct terminology. I'll have to check with Caitlin.
Hi, Jennifer. I just
Oh, there
joined.
she is. But there was a very small percentage of people that were participating in NCI. And as a result, and risks, I guess, associated with them maybe being able to be identified, that portion of the National Core Indicators will not be released, I understand, with this information. Well, here's my brilliant colleague, Caitlin Stover. She did the analysis of all of the survey data. We worked together to draft the questions, and we also worked in partnership with the Department of Developmental Services. We were so grateful that Jacqueline Grant met with us ahead to give us feedback and take a look at the questions, and also support from Tim Cahill, as well as the acting deputy director at the Department of Developmental Services. So we see this as a very exciting opportunity for us to be more informed about what's happening in the program, what's working well, understand more about why people choose it, and of course, how things that people need more assistance with who self-direct. So I'll go ahead and I'll hand it over to you, Caitlin. Good to see you.
It's good to see you. Thank you, everyone, for your patience. My name's Caitlin Stober. I'm a policy research associate with the MDDC, but I'm also a PhD student where I study disability policy at Brandeis University. So I had a required class that ended at 2, and I was just able to sneak out a little bit early. So Jennifer, are you in control of the slides?
I am not. I think it's Jackie or Diane.
Okay.
Diane's doing it.
Okay.
If it's possible, could we go to the next slide? So, Jennifer, I'm assuming you've introduced yourself. I just introduced myself. In addition to working for the Massachusetts Developmental Disabilities Council and working at Brandeis University as a PhD student, I'm also a sibling. So my brother has Down syndrome and is a service recipient in the state of North Carolina, but that's also informed kind of my experience and understanding of this area. So we can go to the next slide.
And I'll also add, I'm also a parent. I have an adult daughter who's 26, and she uses self-direction. She lives in a different state. She lives in New Hampshire. But, we've been supporting her in that for many years. So we have many years of experience and that outside perspective of how another state organizes or structures their self-direction program.
So we just wanted to share a little bit about the Massachusetts Developmental Disabilities Council for folks who aren't as familiar. We are part of the DD network here in the state of Massachusetts. So we are federally funded, but we operate as like an independent organization agency for our state. And our mission is to empower folks with intellectual and developmental disabilities and their families to live successful lives in the communities, promote self-sufficiency, community inclusion, and opportunities for everyone. So that's part of why we're here in addressing this topic. We see it as an avenue towards this mission. Next slide, please. And we can go to the next slide. So I think Jennifer talked a little bit about this survey that we decided to do. And the general aim was to explore the self-direction experiences of folks with intellectual and developmental disabilities here in Massachusetts. I also caught the tail end of one of the reasons we're trying to do this is we don't have a lot of data about self-direction experiences here in Massachusetts. The National Core Indicator Survey is a wonderful source of data about the lives and experiences of people with intellectual and developmental disabilities using services in a state. Participation is voluntary, and the last Massachusetts did participate in the most recent cycle, and that's for 2023-2024. but it's a random sample of service users in the state, and not enough folks with self-direction were in this kind of sample, so we're not able to get state-specific data. With our aim, our goal is to share it with you all, with community members to kind of support advocacy efforts in the state. And the development I also heard Jennifer talking about was very much informed by input from both the MA21 coalition and as well as DDS. We're so thankful for the input because we really see this as a team effort of us working together. We know there's things going really well. We know anecdotally that people like this service model, but we also wanted to see what are the most important areas that we can advocate and work on to improve those experiences. Some of the measures we included also are validated in the sense that they are from the National Core Indicators, and I talked to some folks from HSRI about doing that. Of course, we can't really say that they were validated for use for this sample because this sample of people who took our survey are different from the people who take the NCI survey, but it does go to show there's a lot of thought that went into some of these. And then in terms of administration, we were blown away by the supportive community in terms of collaboration for recruitment. And we just want to thank all of you because I think a lot of people on this call, maybe you took this survey, maybe you shared it with people, and we're just really grateful for that. So we can go to the next slide. In terms of who took our survey, we did have over 130 people open the survey, but in terms of folks who provided kind of usable data for us, we had 118 responses. The large majority were from family members, so 85%, 100 people were family members of an individual using self-direction. 10% were folks with intellectual and or developmental disabilities who were using self-direction, and then 5% of the sample was folks who had a different kind of identity in relation to self-direction. Sometimes it was a support professional who worked on self-direction with someone, but we still accepted those responses and kind of wanted to hear about their experiences too. Most participants also came from the participant-directed program option of self-direction. 13% came from agency with choice. We also accepted responses from people who were interested in self-direction but waiting. Perhaps they haven't been able to start these services yet, but still had opinions about why they chose self-direction or things that even in this onboarding process that they've had positive or challenging experiences with. And then some folks didn't know which form of self-direction they use, which is also okay and kind of speaks to the importance of transparent information. They know they use self-direction, but then when they hear participant directed or agency with choice, these are confusing things that they weren't sure where they fit. We can go to the next slide. We also had great spread across DDS regions, which we were pleased with. So you can see it was pretty much a quarter per region. I didn't break this down by specific local or regional office, but in terms of Northeast, the metro area, Central West, and Southeast, we had about a quarter of our participants came from each. I will say that while I said we had 118 respondents, filling out demographic information was optional. We didn't want people to share things they didn't feel comfortable with, including their own demographic information. So this is based on about 80 of our responses, so it doesn't include everyone. But we're really pleased that not everyone came from, Boston or something like that. So we can go to the next slide. I am going to talk us through some of the preliminary findings from this survey. Now, we just closed the survey last week. This is the first time we are sharing out findings with folks, so I would really welcome your feedback on how we share this information. If you have any questions, feel free to drop it in the chat or interrupt me. We'll also have time for questions at the end. I'm seeing we have a question around if the slides will be sent out. I believe they will be, and I would also I'll talk about this at the end. We do hope to have a public webinar or another presentation with more folks from the community to share these findings so individuals have some of this information and tools in their own advocacy efforts. So we will also keep you all updated about when that's going to happen. But we can go to the next slide. So we're going to start by talking about, in terms of self-direction experiences, why are people self-directing? Why did they choose this service model? We can go to the next slide. In our survey, folks had an option to tick as many boxes that applied to them, with some of the main reasons anecdotally and from the literature we know that people self-direct. And some of these are overlapping thematically. Um, but generally speaking, over 68% of folks in this sample said, we chose it for increased choice and control. 62% said they did so for increased flexibility and freedom. 57% for more personalized supports that they weren't able to access in a traditional service delivery model, excuse me. 46% said for more community engagement. They saw this as an avenue to enhance community participation. 46% again for increased independence and autonomy. Then we also had some folks who were directly recommended this service model or service delivery model by DDS or other family and friends. And for some folks, traditional services were not available at all. We definitely had folks who, through their commentary, expressed traditional services were not appropriate or suitable, but for some folks, it just wasn't available. So I'm going to dive into each of these reasonings a little bit more. We had such wonderful participation in this survey. The amount that people wrote in to explain their experiences to us amounted to like 30 pages of single-spaced text. So people really shared their experiences with us, and I chose to just pull a few quotes for each of these things to kind of paint a better picture because I think that the words of our participants are say more than I can in summary. So if we could go to the next slide. In terms of increased choice and control, we had a participant say, I chose self-direction because I want to have more control over my life, who supports me, how I spend my days, and the goals I'm working towards. It lets me build a team I trust and create a life that really fits me. We can go to the next slide. For flexibility and freedom, we had a participant say, we have the flexibility of creating a schedule that fits my daughter's capabilities, medical diagnosis, preferences, etc. We can go to the next slide. For personalized supports, we had someone say, not everyone has the same needs, and PDP, which is the participant directed program, lets us decide and try different things we think might work well or help. And if they don't, we can change it and try something else. I will say for each of these quotes, I just pulled one, but for each of these kind of topic areas, we had multiple people sharing similar sentiments. So we can go to the next slide. So we heard about more community engagement. This participant said, when we have staff available, my daughter is in the community every day, working part-time, volunteering, doing something she loves, going to the gym, learning and practicing independent living skills. She enjoys the choice and freedom she has and feels bad for her friends who sit at home or are in programs. She lives a meaningful life. So I chose this quote. We had a lot of folks saying that maybe some of the community-based day programs that were available through traditional service models was not providing adequate opportunity for community engagement and participation. We can go to the next slide. Independence and autonomy. So this person said, I get to choose my own staff and keep people I trust. I like being able to plan my own schedule so I can balance my support time with my work. So this was something in terms of independence and autonomy, not only getting to choose your staff or the services, but also saying, hey, I have a community-based work in the community, and if I go to a day program, that doesn't fit my work schedule. So this self-direction was a way for someone to kind of customize and support their own independence in their life. We can go to the next slide. And then traditional services we spoke of sometimes were just not available, but a lot of folks said, this wasn't suitable. There weren't appropriate options that really met the goals and needs of either themselves or a family member who is using self-direction. So this person said, traditional program options were wholly inadequate to meeting the goals of my son's life, to continue to develop skills to participate in life in the community. Okay. So that was a little bit background about why people said that they chose self-direction as a service delivery model. We're going to see some overlap with self-direction experiences when we ask people questions around what was working well for them. So we can go to the next slide. So to kind of broadly speak, what we're going to talk about in this kind of wins section, people with intellectual and developmental disabilities were involved in decisions when it came to self-direction. People felt like they were getting access to personalized services and supports, and that for the most part, they had control over these services and supports. People also talked extensively about having the authority to hire people they wanted to work with. So the choice in staff was a huge recurring theme. We can go to the next slide. So in a question we asked when we said, who makes the decisions about your self-directed service? We had about 20% of folks say that themselves or the person receiving self-directed services was the one who was making the decisions. Then we had another 39%, so roughly about 60% of our sample said that person had some input. So in about 60% of the cases, at least, we know that people were involved in decisions about their services. We had 15% who said other, so these people chose not to fit into one of these categories, but maybe wrote an explanation of engagement. Some of them might fall into having some input. And then for about 25% of respondents, they said that either a family member or a friend was primarily making the decisions about self-directed services. I have kind of a quote. Oh, sorry, on that slide. I have a quote, another kind of feedback that somebody wrote in that said, there's so many things in the community I choose, where I go to work, going to school, volunteering, self-advocacy groups, singing lessons, going to the gym, going to see plays. So this I thought just illustrated how this was an instance where the person said, I'm making the decisions about the services I receive, and they're getting to choose what they do in the community with the support that they were able to set up through self-direction. In terms of personalized supports, again, we see a majority of people are saying that yes, through self-direction, I get to have supports and services that are personalized to my needs. So 69% of our respondents said yes, that the services and supports are personalized. Another 21% said that sometimes they are. So we're looking at 90% of the respondents to this survey are saying that their self-directed supports are personalized to their needs and goals. 10% did say they were not. So that's, of course, something to acknowledge. But on the whole, we're seeing that people are able to have those personalized supports that they wanted, which was a reason a lot of people chose this avenue to begin with. One participant who was a family member said, self-directed choice allowed us to create a mold that is fitted just for our daughter. In doing so, we don't have to force her into other molds that were created by others for other clients. Okay, we can go to the next slide. And again, for the most part, the majority of respondents felt like they had the amount of control they wanted with the services they self-directed. So 56% just said, yes, we have the amount of control we want, and another 24% in between. So sometimes they were able to exercise control. Some things that they wanted were outside of their control. But again, that amounts to about 80% of respondents were saying that they were pleased with the control they were able to exercise in a self-directed service delivery model. And some people brought this back to hiring staff, which is its own theme, but I'll read out this one. So a participant who was a family member said, choice in staff that my son likes to be around and that are qualified to help him and enjoyable for him to spend time with. ability to do what my son wants, play sled hockey, drum in a band, work at Fenway Park, go to the gym. My son needs help with doing all of this, and Self-Directions provided that support to let him live his life in the community. So I chose this quote because it's about being able to choose staff, but it's about being able to choose so many things. And similar to some of the other quotes we've already pulled, creating a mold that fits this person and their interests. This is a person that wants to play sled hockey. So kind of getting to know that this is an individual person and that this family felt like self-direction allowed them to have control to make things work. We can go to the next slide. So this leads right into the theme about, do you feel you have employer authority or the ability to hire and fire staff to work for you, the person receiving services, or your family member who's receiving services? And this was a huge thing that came up over and over again. So 77% of folks said yes, they feel like they've got that employer authority. 15% said in between, and only 8% said no. When people We'll kind of get into this a little bit when we talk about challenges. When people were saying no in this instance, they didn't feel like they had the employer authority. Sometimes that came down to feeling like there wasn't enough staff available. So we had someone who said, a family member said, my brother requires a one-on-one, and he's had some really bad ones, meaning staff who weren't working in a one-to-one support setting. Self-direction allows us to pick our own person. We can go to the next slide. So I just wanted to call out this theme at this point in the presentation because it's something that continued to come up. But self-direction, some people seem to select or appreciate as a response or almost a band-aid to the direct care workforce crisis. So people are having a hard time finding staff still that might meet their needs, but they're seeing this direct care workforce crisis also happen in traditional traditional services and in different day programs, for example, and things like that. So this person explained that in community-based day services that are serving both of their sons who are using DDS services, it goes through good waves when staff take the guys into the community, and then waves of low staffing where they sit around doing nothing in the building, the antithesis of the term community-based. By self-directing 2 days a week, I get 2 days where I can assure my sons follow their interests and don't just sit around. So I think what this person's comparing is that for part of the week, their family members are enrolled in community-based day service programs that you might be able to access through traditional service delivery or possibly through self-direction as well. But then 2 of those days a week, they're planning their own community events with personally hired and individualized support to do these things. And those were the days the family member had faith that their family member was truly participating in the community versus sitting around. All right, we can move on. So overall, I think hopefully folks here are feeling, people are choosing self-direction. It is a service delivery model people are eager about. They like that is appealing to them for a variety of reasons. We we heard about some positive experiences people are having. They feel like they've got control, things are personalized, they appreciate the ability to hire staff that works for them. We did in some of the questions notice that there's a number of challenges and areas that folks said could use some change to make self-direction work better for them or their family member. So we're going to dig into some of those themes now. So on the whole, people did have some commentary about a need for more information about service and support options through self-direction. When the world is your oyster, how are you going to pick what works best for you? The need for support when it comes to finding support staff. We also had a number of comments, which I don't think are new or surprising, but regarding the financial intermediary that people in the participant directed program are using, it recently switched to Acumen. Previously, it was a different provider, and we received a number of commentary and feedback that this platform has not been accessible or easy to use or understand. And then we had folks commenting on their budgets and specifically budgets not being enough to meet their service and support needs. So we're going to dig a little bit more into each of these themes now. We had kind of a check all option where we provided folks with a list and we asked people if they needed help with any of these areas when it came to self-direction, and then we gave them an option to write in additional things they needed help with. And I do see that, or we can see that over half of our participants said that they needed more information about what services and supports you can get through self-direction. So, struggling to identify what can be covered, what is not covered. People want to be able to wield this creatively to meet the needs of themselves or their family members. And we're running into some bureaucratic challenges in terms of what was and was not possible. People were having a hard time finding and keeping staff. Again, so that was about 40% of folks who responded. People were struggling with the financial intermediary service with Acumen. That was about 35% of people specifically ticked this off. And that's 35%, I should note, of the entire sample. So we know if we go back to the beginning, I think it's about 74% of folks were in the participant-directed program, so this applies to them. We also had folks express that they needed some more help or support with communicating with their service coordinators, managing benefits for staff, getting staff paid, which also ties in for many instances with the Acumen platform, planning their own service needs and scheduling staff, training staff. And then we had 13% of folks who said that they did not need help with any of these things. So for them, their self-direction, they've got it fine-tuned and they didn't need additional help or support. We can go to the next slide. So one of the challenges we heard was around availability of services and supports. So we asked the question, are the services and supports you want to self-direct always available? And I see the percentages have been left off here, but 41% of folks said no, 33% said sometimes, and 26% yes. So only about a quarter of folks we heard from were saying the services and supports they wanted were always available to them in self-direction. I pulled a quote from this that someone said, "We would like more flexibility in how we can use self-direction funds to support my son's person-centered plan. We are still in a space where I feel we hear about support that's available, only to then hear that it's only available under certain conditions, agency with choice instead of the participant-directed program, or only through traditional services, etc." So this person said, being able to have the services really meet the needs of the individual without restricting people to certain programs or codes would be really helpful. So this spoke to both availability of services supports and also kind of the need for information. And illiteracy, you don't know what you don't know. And for many families, they're getting this information from other families. And this was something that came up in quotes too, of feeling like, where is some centralized information that can help me understand what we can do and what we can't do. And then if we can't do something, why can't we? What if this is the best thing for me or for my family member? We can go to the next slide. So we asked two questions for people in the participant-directed program, PDP, about access to the new Acumen platform. So firstly, we asked, are you able to access information about your budget and services from Acumen? And 68% said yes, 19% said maybe, or they weren't sure, and only 13% said no. This is seems good, and it is, but this number should be 100% because this is the only avenue in which people using PDP can access information about budget and services. So we really, so we're on a good track, but we need to kind of increase that to make sure people understand this is how they can access that information. When we dug a little deeper and said, okay, we've got access, that's one foot through the door. The next is being able to understand and hopefully use this platform to make your self-directed experience as smooth as possible. And there we got some different feedback. So 41% of folks said no, Acumen is not easy to understand. And actually 49% of folks, so this um, I might have mislabeled, but said they can understand it, but they need help to do so. Like some things they can understand, some things they can't, but they really need help to understand it. And only 10% of our respondents said that they can understand the information on Acumen by themselves. So this is concerning because a lot of our participants here were family members. And if we've got family members, this is self-direction. We want to be giving folks with intellectual and or developmental disabilities the maximum amount of control, leadership, and input. And so there's just been some feedback that Acumen has been particularly challenging, in regards to access and understanding. We can go to the next slide. I think we've got some quotes. So this person, just kind of represented a myriad of the frustrations that were aired relating to Acumen. They said, my experience with PPL, which was the prior service, and Acumen has been frustrating and at some times totally unacceptable. DDS needs to pressure Acumen to update its technology with regard to time entries, approval of hours, identifying budget numbers, and being able to access budget data in more comprehensive formats. Implementation of Acumen was a disaster, which is leveled out, but the technology platform is marginal at best. So this person clearly is having a difficult time with this platform. And we had a lot of similar commentary. We even had folks note that with the rollout of Acumen, it wasn't just challenging to use. In some instances, it actually made it impossible to access certain budgets to pay people, and it really affected the day-to-day lives of people not being able to have staff because they couldn't hire them or because they couldn't pay them. So this was something that a number of people expressed was really challenging and had both immediate impacts as well as kind of additional administrative burden, which can prevent people from accessing this model delivery type. We can go to the next slide. Then we also had questions around budget. So we wanted to consider someone's budget in relation, of course, to the needs for services and supports that they had. So when we ask people generally, have your service and support needs changed during your time using self-direction, 51% of our respondents acknowledged that they have had more needs. Their needs have increased since they started using self-direction. And that's important to keep in the back of our minds. We broke it down by year, which I'll go into in the next slides. But generally speaking, we're seeing people have an increase in needs, but not necessarily an increase in budget. When we ask the question, is your budget enough money for the services that you need? This was a general question for this point in time. And 44% said no, their budget's not enough to meet the needs of them or their family member. 29% said maybe or they're not sure. In some ways it's adequate, in some ways it's not. But only a quarter, only about 27% of our respondents said yes, the budget's enough to meet the services that they need. We can go to the next slide. Uh-oh. There we go. Okay. So in terms of this theme, we had someone say that we are so glad and grateful to be part of the participant directed program. However, we are very concerned that this year DDS received a rate increase for day programs, but has not applied these funds to group day activities under participant directed program. Even though the day rates for the program has increased, this poses a real budget challenge for our family. So this quote was just one. We received some similar sentiments from people that were basically saying, hey, there's been rate increases, but my budget hasn't been adjusted. So if you go through traditional models of service delivery and you're accessing a community-based day program, the amount of money allocated for you to access that might increase, but when you're using self-direction, it hasn't. And so this poses a real challenge about how we have to use this limited budget that we have. Are we able to continue using this service and supports, but we get less of it, and then we have unmet needs? So, really, a number of people expressed gratitude for self-direction, but challenges in terms of stretching the budget to make it work as like a viable long-term service delivery model for them and their family. So I broke this down by year. And what we looked at, we asked people some of these questions generally, but then we asked them some specific questions around in 2025 for folks who are using self-direction. So now this is kind of a smaller portion of our sample because people have used and accessed self-direction in different years. But so in 2025 specifically, 51% of participants said that their needs increased. Yet, only 14% of folks said that their budget increased as well. For 63% of folks, the budget stayed the same. And then for 7% of folks, their budget actually decreased. And some people weren't sure. So we asked people to share the information they had available. This survey, we were so grateful people took it and shared all this information because it was a long survey. And so some people didn't have the capacity, I guess, to check exactly how the budget may or may not have changed. But we can look at these bars separately. But what I actually did was then I limited my analysis to say, okay, of the people who said yes, my needs increased, we see that only 17% of those people had a budget that increased. So the other 83% of people who had needs increased had a budget that stayed the same or decreased. And that is causing some of these challenges. And this isn't new to 2025. So if we look at the next slide, we did this again for the year 2024. So in this year, we had 53% say that their service needs and supports increased, but only 22% of people had a budget increase. So the large majority in 2024, 64%, said that their budget stayed the same. And again, when you look at that portion of people who said, my needs increased this year, only about half of them, or sorry, about half of them had a budget that stayed the same. So a lot of people are being left without a budget increase that parallels a needs increase. And so we had information that went back to 2015 that perhaps we can go more in depth for a future webinar. But this is, when we did that, it kind of gets smaller and smaller, people who are willing to go back year by year. So our sample was getting smaller to run these numbers with. But I think it just, yes, Jennifer.
Someone asked, is this agency with choice? This is a combination, correct?
This is a combination. So this is for all folks, whether they were using agency with choice or participant directed program. That's a great question because the previous charts on Acumen were just for folks in the participant directed program. Thank you. Sorry for that lack of clarity there. So we can go to the next slide. So there were a lot of quotes about budgets, and I chose this one. But this person said, we have been involved in self-direction for 8 years. Our budget has not increased in 8 years, despite showing need and having to offer increased hourly rates to hire staff. This is not sustainable. Traditional programs have had increases. Why not self-direction? So for this person, nothing has changed in their budget in the last 8 years. And we know from inflation alone that a lot has changed in the last year. When we look back at the theme of self-direction as an antidote to the direct care workforce crisis, that people have increased concerns about some services and supports in the community because of limited staff or high staff turnover or inadequate staffing or training. People turn to self-direction because they wanted control, they wanted quality. Um, but people are having trouble hiring staff under self-direction too. And this challenge is amplified when people don't have adequate funds. They can't offer folks competitive rates. This makes it extremely difficult to retain staff. And when we have staff turnover, that's also associated with, some worse outcomes for folks in terms of their community living goals, and engagement. So this was just one person's quote, but we saw a number of quotes that were saying, this isn't viable for us. If our budget doesn't increase, how can we keep doing this? Why do we see increases in the traditional service delivery models for folks using that avenue, but not for us? So you can go to the next slide. So I wanted to leave a good amount of time for discussion to hear some thoughts or questions from the audience. Talk about our next steps in terms of what more information you have questions about. This was kind of a high level summary of some of our findings for some of our main questions. We did have additional data points and we have plenty more quotations and qualitative data that we can kind of share to on some of these themes. And we also would love to hear from you all about how this can be applied by you or in your networks for advocacy purposes, how we can share this information in a way that is most useful to the community. We've had wonderful partnership with DDS to this point. So, we also hope to have some conversations with them so that they can use this data to inform their own work. We know in a lot of instances, people are trying hard to make improvements. So, yes. Okay, I am gonna. Oh, great. Now I can see hands and folks, and I see we have some. So, the first person I see is Ed. Do you have a question or a comment for us?
So, Caitlin, we've got over 60 people on today's webinar.
Mm-hmm.
I'm guessing they didn't all have an opportunity to respond to the survey. Is it still open and how do they access it?
Oh, Ed, thank you. What a great assist there. The survey is still open. So this analysis was cut off last Friday. We had like I said, we had 135 responses, but I had to be a little bit conservative and make sure that the data we were including in kind of our summary analyses was more complete. So if I was seeing incongruencies or there was mostly all missing data, then I didn't include it. So people can continue to take this survey. I will update my analyses, probably set a new date to do so if we're going to have a public-facing webinar. And it looks like Diane has dropped in the survey link in the chat. Thank you so much. And I also want to put in a plug now that I'm a face to this crowd. If you have someone who wants to take this, but surveys are difficult, they can be overwhelming. I am so happy to hop on a Zoom or do a phone call and walk someone through it and answer their questions so that they can fill out the responses that best represent their experience. So I am also available. So the link is there and you can send people my name. I'll drop my email in the chat and I'm also here and available to support people in taking it. Thank
Hey,
you.
Diane, where on the MA21 site is the link? I don't see it on the website. Maybe a direct link to the survey would be better.
Survey.
It should have
Okay.
been right there on the home page. So thanks for pointing that out, Ed. We need to look into that immediately.
I may be missing it, but does somebody have the direct link to the survey?
I have the direct link. I have a lot of tabs open on my computer right now, but I'm sure by the end of this session, I'll be able to get it and send it out to respondents with the slides and the recording and make sure it's there. Because I would love for this to continue to go out and reach more people. Jennifer, what was
I
you
just
sent
dropped the
me?
link in the chat.
Oh, perfect.
Beautiful.
Oh, I forgot to update it. It says here still take it before the 10th, but we are going to leave it open so we can collect some additional information. Caitlin will continue to work on a more
Yeah,
thorough evaluation of the survey, and we're looking to January to do an information session with the DD community, which we will put out on our social media and send out with our contacts. We'll share it with members of the MA1 coalition and get it out there for folks as well. So she needs some more time to be able to crunch the numbers. And I mean, what did you say? 30 pages of written responses.
Yeah. And that's
So
kind of rare, folks. I
Yeah,
have
so-
to say.
So
Sorry,
anybody
Ed.
else wants to have your voice heard, jump on that link, grab it, and please participate.
Just disregard the November 10th. It is staying open.
Yes, I'll do it. Oh, okay. Sorry.
I'm just not sure that link is working. It's taking me
Oh.
to SurveyMonkey,
Right. It is a SurveyMonkey
but
link.
it says,
It's
"Do you
not.
want to create a SurveyMonkey?" That's not what it's
Oh,
supposed to say.
okay. Let
You
me
want to
double check
create your
that.
own survey? It's saying, "Do you want to create your own
Yeah,
survey?" Oh, that's because I already took it. Sorry. That
Oh,
might
okay.
be why.
Oh,
It won't let you take it again. Got it. Okay.
okay. So I see that Diane, you also have your hand raised.
I'll try to be quick. I'm
No,
not going
take
to
your
talk
time.
about my personal experience where my sister's budget was cut drastically. The reason being that she's suddenly residential. My opinion being that residential services should not impede day program services, which self-direction is. And so now she has no budget for her activities. That aside, I think I want to thank you. This was great. I did the survey. It was a very good in-depth survey. It asked questions that didn't make me crazy. I was unable to go back 2 or 3 years to say how the budget had changed, but other than that, very helpful. I think it would be maybe 2 next steps. What is DDS's response to this? And also, if we could be more informed about the budget. So some very interesting thoughts came up towards the end where people said, well, certain budgets have increased. You know, how does this affect self-direction? So I think we, or at least I, don't have a good understanding of where self-direction funding fits in the DDS line item world and where it fits in the DDS, CBDS funding world. So just a couple of thoughts for phase 2. Thank you.
Thanks, Diane. And that does echo some feedback we got from folks about I want to do some individual advocacy. Maybe I want to talk to my service coordinator. Maybe I want to talk to even a representative of mine in the state. But it's really difficult to discern how the budgets are applied in different service delivery models, whether it's traditional services or self-direction. So we did have folks request more transparency around the budget process to help them understand not just maybe what they can advocate for, but also try and pick the best thing for them. And for some folks, it seemed like they were considering traditional services because then they would be able to access things at a lower rate and get things covered that they weren't able to stretch their self-direction budget towards right now. So I appreciate those thoughts. And all I can say about DDS response is that we were so fortunate to have good collaboration in creating this survey. They supported the creation of this survey, and that makes me feel like they will be excited to learn from it, just like our community is. I do think that some things are not surprising. I think they know that there's been a lot of challenges with the Acumen rollout. So I am hopeful that we can have some dialogue with them and kind of yeah, move forward together. Jennifer, I don't know if you have anything to add on that point.
Not at this time. Obviously, we'll continue a conversation and continue to partner with DDS. There was a lot of motivation and support that we received about doing the survey and receiving feedback about how we might be able to word the questions better. Jacqueline also provided like lists of menus so people could actually check off the vendors or providers that they use. And, they're really excited about looking at how they can continue to strengthen the program. So we'll make an appointment and we'll be sharing more of this information. Plus, Tim Cahill serves as a DDS state agency representative on the Massachusetts Developmental Disabilities Council. So we have, regular contact and work collaboratively with GDS, and will continue to do so, especially on this topic.
Okay, I see some other hands. Um, can I go to Karen next and then back to you, Ed? Okay,
Hi, can you hear me?
I can hear you.
Great, thank you. Hi, thank you very much for today's webinar, workshop, whatever whatever we're calling it. So I'm a disability advocate, and many of my clients struggle with a few things that I just wanted to point out. And I'm hoping, with all transparency from my end, I'm really glad to hear DDS is listening. One of my experiences that from catchment area to catchment area, office to office, I have clients receive different information. So they may hear that, oh, if you have AFC, then you can't have this in the budget. Then I'll talk to the AFC nurse who says, well, I have clients in this other catchment area, and they get both of those. So why is my client in the catchment area, the one you're working with, saying you can't have this, while in another catchment area office you can? So that goes back to transparency, and for families who are frustrated to understand, does the office have the right from office to office to determine certain budgetary constraints that is not across the Commonwealth? And that's a big question I've had for a number of years. Secondly, the fact your findings that for families who are compromised themselves, whether it be language challenges, whether it be food sustainability, whether there be stressors with other members of the family also having disabilities, that they are finding that they can't necessarily get the help they need. And I'm just reiterating what you've already said in some of your survey data, is that they're doing this alone, and Acumen is not accessible enough for them. They have a lot of questions. They really feel that they're working in a vacuum. And so they're suggested to go to the self-directed model, but the reason why they hold on to the traditional model is because someone else is going to do the work for them when they're so stressed themselves with everything that they're dealing with.
Yeah, thank you so much for raising both of those points. I'm hearing the points themselves, and something it's making me think about is when we do our January session. That's kind of a more refined, in-depth look at some of these results. This was our first time sharing them, and like we said, we just closed out it on Friday, so it was kind of a quick turnaround to pull this together. But I'm hearing that I have room to do an expanded discussion on some other specific themes and challenges people raised, because we did see a number of folks talk about confusion, because a lot of people expressed that they were getting information from other people who were also using self-direction. So when we have these wonderful natural support networks, family to family, that are kind of lifelines for people in terms of how to access this service delivery model, then they're hearing things from people at different DDS offices of saying, well, that worked for me, why can't it work for you? And things like that. And hearing just the highlighting of the acumen piece, as well as it being a compounded problem when we already have some elevated access support needs. So I think I'm hearing that, and I'm going to do hopefully an expanded and maybe have more than one quote per challenge, to really try and paint a fuller picture. So please continue to tell people to take this survey, and we'll fill in some more of that space. Ed, what was your question
Yeah, just
or
in
comment?
response to some of Diane Glennon's comments and the discussion after that, I did just want to point out and acknowledge that I think we have a couple of DDS folks on the webinar today, which I think is great
Oh,
that
thank
they
you.
are listening in to this conversation and hearing some of the feedback. So DDS guys, thanks for joining.
Wonderful. Yeah, thank you so much. And like me and Jennifer said, we were floored and grateful that folks helped us shape this survey. I didn't share this level of detail because, for example, with Agency with Choice, we were able to work with DDS to have a drop-down list of the vendors that people were using. We didn't choose to share it because the majority of participants were not in the agency with choice section, so I didn't do any specific analyses of if certain agencies were having different responses or not. But I definitely appreciate that. Does anyone else have questions or comments?
Caitlin, I'm actually looking at the chat. Some of the questions I've actually answered or
Okay.
shared resource. It's not specifically about the survey. So let me just look real quick.
Thank you for helping me monitor that. Sometimes it's
Yeah,
hard to do both.
it
I'm in
is.
the office today, so I'm trying to get from one monitor to the next to scroll.
Let me
Um,
see.
While you are monitoring the chat, one thing I just want to underscore again is the enthusiasm people had for this type of service delivery, even if there were challenges. Um, because I have multiple hats, I'm involved in a lot of emerging research and literature at both, not just a Massachusetts level, but a national level, that's showing that self-direction can really has some strong statistically significant association with better outcomes, whether that's in employment, people who are having less challenges with their workforce, and a lot of community living, participation, loneliness, those types of outcomes. So I think that just underscoring that people aren't trying to quit. People are just trying to find a way to make it work as best as it can because people really believe in it and it's has some good results. So I see, okay, you shared a link about what self-direction is to Curly's question. Wonderful.
And then Juliana McLaughlin, uh, you may have to clarify your comment in the chat or your question. I'm wondering if any agency is in charge of making sure outside agencies do what they say they do.
Okay, so like an oversight question.
Uh,
Um, yes, that is something that I do not have the answers to. We could try and find the resources on the DDS website with that. Um, I'm seeing.
And that could be a conversation to have with the service coordinator, the DDS service coordinator, and then just move up the chain of command.
Oh, okay. And I'm seeing a question from Elizabeth regarding how many of these quoted people live independently. This is a fantastic question and something I can add some details around. We did ask people to describe the residential setting of the person who was receiving services, whether that was themselves or the family member they were responding in relation to. I didn't, while I checked that out, I didn't look at it specifically for each quote. So I can go back and when I use these quotes, I can add some descriptors that say things like, a person or a woman this aged whose family member lives in the family home or independently. We basically asked if people lived independently in the community, in their own home, if they lived in a family home, or if they lived in a group or congregate setting, which in some cases it might be more difficult to apply a self-directed service delivery model in congregate settings, but we know that it does happen in some group homes. So thank you for that question, Elizabeth, and I will get back to you in January with our other presentation.
Let's see. Okay, took care of that. I think I got all of the I think I got all of the questions. Another question. Diane Glennon, did we address her question that she put in the chat? Oh no, it was just a minute ago. Another question for agency with choice. How much do they get paid to find staff and how successful are they? Um,
So
Yeah, go ahead.
I was just gonna say, so this is another great piece of information that we're collecting that would be useful for community level advocacy for increased understanding. This is not something that our survey asked about because our survey was for participants in self-direction, so whether that was an individual or a family member. Um, so we didn't collect that kind of information, but it should be, I'm sure DDS knows there's got to be budget line items that could be broken down to identify the proportion of funds that are going towards the overseeing agency that's supporting self-direction for folks who are using agency with choice.
So I'm going to remind everyone that you would have received a link to provide feedback on today's presentation, or you can send comments directly to ma21@arcmass.org. Either way, any feedback would be most appreciated. Just repeating, we use the feedback to plan for future webinars and also to be able to follow up and just expand off of the information that's been provided.
Yes, thank you so much for calling that out. I just dropped a link in the chat. This is a link to the feedback of this presentation, which will help us prepare for January's. It's also helpful for us at the Massachusetts Developmental Disabilities Council because we do have some annual reporting requirements where we kind of discuss the community engagement we're doing to show that we're trying to engage in the community and be supportive. So when you give us feedback here, it's also helpful for our reporting requirements as well. So it's just a few questions. If people are willing to take it, should take you 2 minutes, no more. All right.
So Jennifer and Caitlin, thank you so much. This was a great presentation, and thank you everyone who's still on for attending, and sign up for those MA21 communications. Thank you so much. Take care.